Yeah, Dr. Rutledge, I think we need to discuss a little bit about the post-operative diet, whether or not our patients should be taking the protein powders, and what is the role of vitamins. There are many patients in my series who are not taking vitamins, and still many of them are good. There are patients who are taking vitamins and still they have deficiency. So what do you say about your practice, your experience from last more than 2 decades in mini gastric bypass?
Well, first of all, everybody can be low in vitamins, and because they're sometimes low in vitamins, they're recommended to take vitamins. So, of course, if you have low vitamins, you should take vitamins, you should check them, and things like that. The majority of my patients and patients I've contacted around the world don't take their vitamins. On the other hand, is it best to get your vitamins by pills, or is it best to get them through the diet?
Natural diet, yeah.
Yeah, and so let's talk about that. Is vitamin A, for example, as valuable as a pill as it is in the food that has vitamin A? So let's just go through that for one quick second. I know I only have a minute to talk, but basically there's been a good deal of research that if you have a normal vitamin A, you're less likely to get lung cancer. Okay, good. Vitamin A is good. We like vitamin A. And many years ago, 10 or 15 years ago, there was a high rate of lung cancer in veterans coming back from the war. So our Veterans Administration did a study of 17,000 veterans, half got sugar pills and half got vitamin A. At 8 years, they stopped the study because those getting the vitamin A pills did worse.
Okay.
Now wait a minute, how can that be? Well, the answer is the vitamin A is a sign. In other words, if a train comes, they have a train crossing, they have bells and red lights, and the gate comes down. But the gate doesn't kill you. The red light doesn't kill you. The vitamin A was not what protected against lung cancer, because people who got vitamin A actually did worse. What happened is vitamin A was a warning. It's saying, I want to tell you something. I'm not going to tell you what it is, but vitamin A told us that those people were eating something else. High vitamin A comes from eating foods with vitamin A, especially carrots, and other brightly colored vegetables. Brightly colored vegetables protect against cancer. You could eat a terrible diet and have lots of vitamin A pills, and in our veterans, it didn't help and it actually hurt. The same kind of studies have been shown in vitamin D and vitamin C. Remember the pandemic, they said vitamin C will help, and then the controlled trials. The most important thing that I pass on to my patients is, number one, eat a healthy diet. And that healthy diet we can go through if you want, but for this presentation is vitamin pills are fine. High dose of pills that you put on your skin, things like that, probably not a good idea. And like you, my patients who are 10 and 20 years out from MGB often stop taking their pills. My experience with hundreds, thousands of my patients and patients around the world is healthy diet, healthy patient. Lots of vitamin pills, no vitamin pills. The most important thing is healthy diet.
Good. Thank you very much.